Hi Lauren, great to see you again.
Hi Nicole, hi Phil.
Yeah, he's not crash hot at the moment. He's really out of sorts. Yeah.
All right, because it's been a while since I've seen you both. Yeah, all right. What have you noticed? What's been happening?
Yeah, he's been quite confused since he come.
Okay, so we were very briefly discussed pain. That might be a cause of this moaning and agitation. Have you done a pain assessment at all?
No, how can I do the pain assessment with the people like Philly? He's always on bed and is hardly mobilized.
Okay. We actually have a tool, the Abbey pain scale, and it's actually been designed for people just like Phil that are in bed and probably are finding it difficult to communicate verbally what's happening with them. So it's a really good idea to use this tool for people like Phil. So why don't we run through it now?
All right, sure.
Yeah, all right. And I know that, Nicole, you're quite familiar with the Abbey pain scale because we've used it in the past with Phil.
We had great success with that at home.
Yeah, all right. So the Abbey pain scale just looks at different areas to see if the pain is affecting them in any way. And the most important thing is to do the Abbey pain scale whilst the person is being moved or moving around. So for somebody that's in bed, that's moving the person in bed, doing their general care, that sort of things, that's when you would actually do the Abbey pain scale for them. So if we think about when he was being moved in the bed before, we can actually get a bit of an accurate idea of his pain level. So the first area looks at vocalization, so if he's whimpering, groaning or crying. So what do you think about Phil in terms of what you observed before with him?
I think he always whimpering. Yeah, but for the people always like this, how can we score this?
Oh, so he's always whimpering. Yeah, so the tool is a subjective tool. So the question asks, is he whimpering? So if he's whimpering, we would give them a score.
Okay,
All
even
right.
though he's always like
Even
this.
though he's always like that. And if it's just something that is a once off, the tool will pick up on the general score. It just gives us a bit of an idea. So because he's mostly doing that all the time, I think we'd need to score a 2 for that.
Yeah.
The next area is looking at facial expression. So when he was being turned over in the bed, was he looking tense, frowning or grimacing? What was his face telling you?
I think he's looking tense in the face.
I'd agree with that.
Yeah. Okay. So, and that was most of the time.
Yeah.
He was being turned. All right, we'll score that a 2. Yep. So the other area is looking at changes in body language. So either fidgeting, rocking, guarding a part of the body, or even being quite withdrawn, so not moving as much. What do you think about that?
I think when we reposition him, he is quite withdrawn, especially the leg.
Yeah, I'd
The
definitely
legs.
say that.
Okay, so he's sort of guarding his legs as well?
Yeah.
Yeah, okay. So because he's got the 2, we'll give him a 2. The fourth area is a change in his behaviour in general, so either an increase in confusion, refusal to eat, or even just a different change in his usual pattern. So that just might be he's not as alert as normal, or he's not eating or drinking. Have you noticed anything?
Yes, he always confusing, but since he come here, I think he's very confusing. So I'm not sure whether this would be the problem.
So if you've noticed an increase in his confusion,
Yes.
so if his confusion is just stable, then that's okay.
Okay, I see what you mean.
Okay.
And I don't know, how was he before?
Well, now he doesn't recognise us all the time, so that's a real change, because before he always knew who we were.
And that's only the past week or so?
Exactly,
Yeah.
Probably 10 days.
Okay, so that is a change, so we'll score that a 1. The next section is on the physiological change, so that might be the temperature, pulse or blood pressure outside what the normal limits might be, or even perspiring can sometimes be a sign of pain. So I guess what might be, have you noticed anything there?
Yeah, I checked the observation chart. I think his blood pressure is a little bit higher than normal.
They're normal, okay. So that would be a 1. And the 6th area is physical changes. So if he's got any skin tears or pressure areas, history of arthritis or contractures, or even any previous injuries. So there's no new skin tears or pressure areas, but we know with Phil that he's experienced arthritis in the past, and that's been quite an issue for him. So we'll give that a 1. So if we add all of those scores up, we actually get a score of 9, which is demonstrating moderate pain. And it's just a tool, so we need to use that in conjunction with what other people have observed in a physical assessment. But the most important thing is what we actually do with that score. So we've got a 9 indicating moderate pain, so we probably need to think about some analgesia, as well as maybe thinking about something else like heat packs or even some massage to go with that, particularly if pain's an issue.
Heat packs worked great before on his knees at home.
Okay, so with the score of 9, we might start looking at some heat packs and also start some regular paracetamol, and we'll see if that makes a difference. How do you think he'll go with that?
Yeah, but he refused to take medication.
Okay, so the tablets he refuses?
Yes, he refused that.
All right, well, we need to work out what's best for you, Phil, and I think maybe, what do you think about liquid paracetamol? How do you think he would go with that?
Let's try.
Yeah. Be worth a try.
All right.
He takes his fluids, all right.
Yeah.
He spit out the medication, so let's try.
Try that, all right. And then if that doesn't work, then there's always other options that we've got as well. So what we will need to do is start the new regime of pain management, and then we'll need to repeat the Abbey pain scale probably regularly for the first few days, and then I'll come back after a couple of days to see the full effect of the regular paracetamol. It takes several days to have a full effect, and then we'll see what the score on the Abbey pain scale is then.
Yeah, sure.
All right.
It's great to know this scale. It's quite useful, I think.
Yeah.
How are you, Felix?
Oh, I'm good. I'm good.
How are you, Nicole?
Good, thanks.
Yeah, good to see you again. I have Lauren here, and I'm coming to do the Abbey pain scale again to see how effective of that medication. Is that all right for you?
Yeah.
How is your pain?
It's better. It's better.
So we'll let you do it. I had a look, and they've been doing it over the past couple of days, and there's been a definite reduction, which is good.
Yeah,
But I think it's good that we'll do it now while I'm here, which is good. You're feeling a bit better, Phil. Yeah, that's good.
Yeah, he's recognising me now, so that's great.
That is good. Yeah. And the heat packs, how are they going on your knees?
They're good.
They're good?
They're good.
Yeah, all right.
How is his appetite recently?
It's getting better. When I bring in the pasta, he'll eat a lot more than he was.
But he still refuses the food here.
Yeah.
So how are we going?
So I got a score of 2 this time, so that means that medication worked very well.
So that's a really big dramatic change, I guess, and we've been seeing that over the past couple of days as well. So it seems that the medication's effective, and the heat packs and the massage as well, which is really good. So we just have to make sure that we keep monitoring the pain, even though he's on pain relief and he's sort of stable at the moment. We still need to keep using the Abbey pain scale and just monitor how he goes.
Yeah, this is very easy to use, and then we just need to take a few minutes to finish that. Thank you for that.